Welcome back to Ozarks Tonight. Well, it's time once again to meet with a member of CoxHealth for our monthly chat. And tonight we're speaking with Jennifer Rains, who works with the inpatient rehab department at Cox. Jennifer, I want to thank you for being here. So what is inpatient rehab, and where are you all located?
Great. Well, thank you for allowing me to speak on behalf of the inpatient rehab unit today. I'm very excited for this opportunity. The inpatient rehab unit is a department within CoxHealth that consists of a team of experts in rehabilitation. This team includes physicians, nurses, therapists, social workers, psychology staff with specialized training in rehabilitation, as well as educational degrees. Our team understands the unique situations that patients have when they overcome an illness or an injury that requires them to have some type of rehabilitation because they're not able to return home just yet. So what our department is we are able to have patients come into our unit. We provide the rehabilitation services as well as physician oversight in order to provide patients to return home at their optimal level.
All right.
We are located just north of the main Cox Hospital of Cox South off of National in the Meyer Orthopedic and Rehabilitation Hospital.
All right, so right there on the medical mile with so many other facilities there. Just for folks at home to get further understanding, I'm sure there's a wide range of injuries and illnesses that people would have that would lend them to have inpatient rehab. Just give us a few examples and maybe some of what the treatments would be for those injuries or illnesses.
Absolutely. So there are a wide range of types of patients that would need inpatient rehab. For example, there are strokes, patients with traumatic brain injuries, patients that have had trauma due to orthopedic fractures, amputations, spinal cord injuries. These are just a few of the types of patients that we will admit into our inpatient rehab unit. And so inpatient rehab has several different types of therapies that we provide. So, for example, physical therapy. Physical therapy is going to focus on everything that has to do with mobility. They're going to focus on patients that need help with walking or wheelchair mobility. They're going to focus on balance to prevent for falls. They're going to focus on patients that require assistance getting up and out of bed, moving from chair to chair. So think of the physical therapy, anything that has to do with movement. Occupational therapy, they're going to focus on everything that has to do with activities of daily living. So activities of daily living has to do a lot with our arms. So we shower ourselves, we dress ourselves, we are able to groom ourselves, even standing at the sink and doing dishes, doing laundry, things that require activities of daily living. Speech therapy. Now, speech therapy is going to focus on everything that has to do with swallowing, as well as anything that has to do with communication in terms of intelligibility. And then also cognition. Many folks after a stroke may have trouble with expressing their thoughts or comprehending some thoughts, so they're going to focus on some cognition. We also have recreational therapy that's going to focus on leisure activities. And in our unit, we also have the opportunity to have psychology staff. They're going to focus on patients and aiding in their adjustment to their particular circumstance.
All right, very good. It's always important when you have folks there. You want to make sure that by the time they arrive at home that they're all taken care of, and there's not going to be any slips and falls, or they're not going to be able to not perform some of their day-to-day tasks. So that's great. So in terms of insurance, will folks' insurance cover inpatient rehab?
Great question. So yes, inpatient rehab is covered by many insurance providers. So we have Medicare, Medicaid. We also accept commercial insurances like Essence or United Healthcare, etc. We also have the opportunity to take self-pay patients. Because we believe that quality care is not just by one payer. Everybody deserves quality care and the opportunity to have some rehabilitation in order to return home. Now, many insurance providers do require a pre-authorization, but my team will do everything in our power to advocate and ensure that we get those inpatient authorizations to come into inpatient rehab.
For sure. And, you know, for folks that are in the hospital, it's never a fun thing and they're always itching to get home. But, you know, of course, there are things they need to take care of a lot of times before they head home, like we talked about. So what's the average, you know, duration of stay that folks are in for inpatient rehab? And at what time can they leave and decide that it's time for them to be home?
That's one of the great things about inpatient rehabilitation is that our program is a very intensive program that provides at least 3 hours of therapy a day. Our average length of stay is about 11 days. So you're going to be discharged when you have the opportunity to meet your therapy goals, when you're medically stable, and when you have met your own personal goals that you have set with your therapist. In terms of how many patients go home, in 2020, here this year, we've had 83% of our patients return home. And in our region, that's about 79%. And in the nation as a whole, it's about 80%. So we really pride ourselves on our quality metrics that we provide to our patients in order for them to return home safely with reduced return back to acute care.
All right. And Jennifer, one quick question before we let you go. How are folks referred to your unit there?
Oh, great question. So if you are in the hospital, now this doesn't mean that you have to be at CoxHealth. If you are in one of our other local community hospitals or even in another community, speak with your physician, speak with your social worker, and let them know that you want inpatient rehab. And they will be able to provide a referral to our unit, to one of our clinical liaisons, and we will be able to come and assist you and evaluate you to see if you meet our criteria. Now, CMS, Medicare, does have specific criteria in order for a patient to be admitted to our unit. But that's one of the things that my team does, is we are able to ensure that you do meet those criteria, that you can be admitted into our unit. The other really unique thing about an inpatient rehab unit is that we have the opportunity to admit patients from home. So let's say you're at home right now watching this and you're not doing so well. Maybe you've had some falls, maybe you're not able to take care of yourself like you did at one time, and you have some medical conditions that need to be addressed by a physician. We would love for you to reach out to us, and we can still evaluate you in your home and to see if you could also be a patient that we would be able to admit into our unit. Because overall, we want to make sure that we provide excellent quality care and that our rehabilitation experts can fit your needs.
All right. Jennifer Rains with CoxHealth. Thank you so much for coming on the show today, Jennifer.
It was my pleasure.
All right. We'll be back with more Ozarks Tonight right after this.